What is the reason of the polyhydramnios in utero of a neonate with EA with distal TEF? Due to inability to fetus to swallow amniotic fluid. What are the most common clinical signs of a neonate with a tracheoesophageal anomalies? Drool, choke, and vomit with the first feeding. Which tracheoesophageal anomaly allows for air to enter the stomach? Tracheoesophageal fistula. What is the clinical test to diagnose tracheoesophageal anomalies? Failure to pass the nasogastric tube into the stomach. Why is pure TEF also called H-type? The fistule connecting the esophagus to the trachea creates a form that resembles the letter H. What is the typical clinical presentation of intestinal atresia? Bilious vomiting and abdominal distension within the first 1 to 2 days of life. Duodenal atresia is due to failure to recanalize. What are associations of duodenal atresia? 1. Double bubble, on X-ray. 2. Down syndrome. Jejunal and ileal atresia are due to disruption of mesenteric vessels leading to ischemic necrosis and segmental resorption. What is another way to describe segmental resorption in jejunal and ileal atresia? Bowel discontinuity or apple peel. Apple peel intestines refer to jejunal and ileal atresias. What causes ileal and jejunal atresia to develop an apple peel appearance? Ischemic necrosis leading to segmental resorption. Hypertrophic pyloric stenosis is the MCC of gastric outlet obstruction in infants. What antibiotic exposure increases the risk of developing hypertrophic pyloric stenosis? Macrolides. What is the electrolyte imbalance seen in pyloric stenosis? Hypokalemic hypochloremic metabolic alkalosis. What are the findings in pyloric stenosis? Thickened and lengthened pylorus. The pancreas is derived from the underscore foregut. What do the ventral pancreatic buds contribute? Uncinate process and main pancreatic duct. What is to become of the dorsal pancreatic bud? Body, tail, isthmus, and accessory pancreatic duct. Which pancreatic buds contribute to the development of pancreatic head? Both, the ventral and dorsal buds. What is the annular pancreas? Abnormal rotation of ventral pancreatic bud forms a ring of pancreatic tissue around the second part of the duodenum. What are some possible symptoms of the annular pancreas? Duodenal narrowing and vomiting. What fails in order to develop pancreas divisum? Ventral and dorsal parts fail to fuse at 8 weeks. What part of the duodenum is in the retroperitoneal space? Second to fourth parts. Which parts of the colon are retroperitoneal structures? Descending and ascending colon. Which part of the pancreas is not found in the retroperitoneal space? Tail. Which glands are retroperitoneal? Suprarenal or adrenal glands?